Well, for weeks, we've been tracking reports of the monkeypox virus around the country, and yesterday we learned about the first confirmed case here in Connecticut.
The man is between 40 and 49 and lives in New Haven County. He's currently isolating. Channel 3 Eyewitness News reporter Matthew Campbell spoke with Dr. Ulysses Wu with Hartford Healthcare to find out more about what everyone should know.
Tell us what to expect as this first case, confirmed case, is being reported, and what we can expect as the months go on. So, Doctor, thank you very much for joining us. And I guess the first question that I have is going to be around panic, right? Because, you know, when something is so foreign and so new, it would be easy to panic. And why should we not panic when we hear about the first confirmed case of monkeypox?
So we shouldn't panic because it has very little pandemic potential. What we are doing is we are facing a new disease on the backdrop of the previous disease, which is COVID, which has a lot of pandemic potential and has infected a lot of people. Now, I don't want to state that monkeypox is not infective, because it certainly is. That's certainly how we get it from person to person. And it's actually a misnomer. It doesn't actually come from monkeys. Monkeys can actually get infected. Theoretically, you could get infected from a monkey, but it's actually more like a rodent pox, because that's actually where you get it. So it has infective potential, but amongst the backdrop of COVID, its infectivity potential is much less than something such as COVID. But again, that's not to say that it's not infective. And there are certain patient populations that you certainly have to take precautions because of its mode of spread.
When we're talking about getting it and how contagious this is, first of all, how contagious is it?
So it's contagious, but not contagious when you compare it amongst the backdrop of something such as COVID. And so you take a situation such as COVID, where it can be spread through a respiratory route. So you don't need to be in contact. This is very different. You need to have contact spread. You have to have contact, and contact usually happens through bodily fluids or through the infected pox like itself, which is very different from something as COVID. So its infectivity potential, although infective, does usually require contact. Now, could it be spread through what we call infected fomites? So there are cases of linens, sheets, things like that, where it may have spread, but really its primary mode of contact or spread is through contact.
In terms for the rest of us, right, the general public, the advice for the COVID vaccine was get it. No matter your age, no matter your health condition, get the vaccine. When it comes to this monkeypox vaccine, you were talking about vaccinations being out there. Who should be getting that?
So that is part of our mission, to make sure that we target the right people that may be at risk for developing this monkeypox, because right now it is believed to be mostly sexually spread at this point. So we are targeting groups to make sure that the education is at least provided to know that if they do develop symptoms, that there can be treatments, that it needs to be diagnosed, but also vaccination across the United States is being targeted to certain groups to make sure that it will help protect them against monkeypox.
Dr. Ulysses Wu, thank you very much for making time for us this afternoon.